My name is Stephanie Smith, and I'm doing a career speech for Speech 1321. Do you ever wonder why nurses are so important in the medical field? I am going to tell you why they are important, how and where they can work. Nursing, there's a lot of things that they can do in the nursing. Treatment and teaching are a couple of the things that I'm going to discuss with you today. A wound care nurse is someone that would work in a hospital or a nursing home, and they basically do wound care. That can be from burns to bed sores to bug bites, whatever. They do require some different education so that they can know all about the bandages that they need to use and the different type of ointments that are applied. Another thing that nurses do is assist a patient with disabilities. This can be a patient that has lost a leg or an arm or just has a learning disability. But the nurse is very important to them to help them with their daily living. Another thing that nurses do is assist with ADLs, known as activities of daily living. This consists of either helping them get up in the morning, brush their teeth, get dressed, eat, and go to the bathroom. Some elderly patients do require a lot of assistance with that, so a nurse is very important to them. Some teaching that nurses have to do is post-op care. With post-op care, they have to teach a patient how to turn, cough, and deep breathe. They also use an ISP, shown here, which is a little machine that the patient would suck air, and they have to hold a ball in one place for so long. It is also very important for a nurse to take vitals. Vitals may be taken every 15 minutes, every 1 hour, 2 hours, or 4 hours, depending on what the doctor has ordered. Now that I have discussed some of the treatment and teaching that nurses do, I'm going to tell you about some of the training and job opportunities available to them. When you first start off, you would be an LVN, and an LVN takes about 1 year to get. After LVN, you can go on to get your RN, which would take you a year to do your prereqs, and then another year, year and a half for the program. It is a lot of education, and you do learn a lot in that time span. Also, job opportunities that are available to nurses are working in a hospital. In a hospital, a nurse would take care of patients. They could be post-op patients, patients admitted because they have pneumonia, cancer. These patients may also have diseases where you have to be really careful on how you treat them and what you wear and wear masks. They also do home health. Home health is great for a person that does not like to be in one place at one time. With home health, you would go to the patient's home anywhere from 1 to 3 times a week, and with that patient you would make sure that they have the medication that they need. You would do vitals. You would also help them with bathing and shopping. Another job opportunity is hospice. Hospice used to be known as for patients that were terminally ill and were going to die within 6 months. Hospice is no longer like that. A patient can be on hospice for 6 years if they need to be. With hospice, one thing that's really good about that is that it is there for the patient as well as the family. LTCs, known as long-term care facilities, is also another place that nurses work. At a long-term care facility, nurses would pass meds. They could do wound care if the facility does not have a wound care nurse, and they also help with activities of daily living. Now that I have told you some things nurses do as far as treatments and the education they can get and the job opportunities, I hope you can understand why nurses are very important. When I am done with my education, I hope to be a good nurse with good morals and compassion. Thank you.